Hello, everyone. We are live. Thank you all for joining tonight's Trendy Tuesday with me and Dr. Sophia Yen. She's the CEO and co-founder of Pandia Health as we discuss trending birth control topics. Before we begin, don't forget to sign up for actual Pandia Health free birth control delivery services. We can write prescriptions for those who live in Arizona, California, Colorado, Florida, Georgia, Nevada, Wyoming, and Washington. As a reminder, Pandia Health is the only women-led birth control company service. So without further ado, let's get started on the topic for tonight, Dr. Yen. How are you doing?
Good. How are you?
Good. I'm great, actually. It's been a great week. Yeah. So tonight's topic. I know it's one everyone is itching to talk about. It's the basics of birth control. So can you give me just a rundown to start off with? Can you give me a rundown of the basics of birth control? Basically, what is birth control? How often can people take birth control? Things of that nature.
Yeah, so there are so many different options for birth control nowadays. You guys are lucky. A lot of new stuff has come out over the years, and stuff that we thought wasn't safe is absolutely safe and has now become the number one most effective, cool method. So those of us who are in the birth control field are now learning to start with the best and work our way down in terms of preventing unplanned pregnancy, and then work our way down to the less effective methods. So the most effective method is vasectomy, but we're not recommending it for those who aren't ready to go there yet. Then you'd be surprised that actually the implant and the IUD with hormone beat a woman having her tubes tied. So that's the second, they're tied up there. And then comes woman tube tied, and then comes the copper IUD, then the implant, and then the shot, and then the vaginal 1 month ring or the 1 year ring, and then the patch, which is every week. You have to wear a patch for a week and then change it. And then the pill, which you have to take every single day. And I think I forgot, I mentioned the shot. The shot is every 12 weeks. So those are all the methods of preventing unplanned pregnancy. Certainly there's fertility awareness method, and there is withdrawal, and there are condoms. I recommend condoms all the time for sexually transmitted infection prevention, but also as a person with a uterus, I don't like to leak semen for 24 hours. So I just think of that always, right? Not just as, and then always great to do, hormonal plus condoms or IUD plus condoms.
Awesome. Absolutely. Yeah. So how often would you say that we need to take those particular birth control pills or any type of method that we can take?
Yes. So at Pandia Health, the ones that we can prescribe you and or send to your house are the pill, the patch, the ring. So what's beautiful about the ring is you just have to think about it once a month. You could leave it in for 3 weeks and then take it out for 1 week to have a withdrawal bleed, or it actually has 35 days of medicine. So and every month has less than 35 days. So you could just put it in and change it once a month on the same day every month. The patch only lasts a week. And so you put one at a time, take it off and put a new one for another week and then another week. And again, you could skip that. You could not do a patch on the 4th week and have a withdrawal bleed. Or if you want to avoid bleeding, you can go up to 12 patches in a row, and then you have to have a bleed at week 13. Otherwise, the estrogen builds up and you could have a blood clot and die, and that would be horrible. With the pill, you have to take a pill every single day. But again, you can do 3 weeks of hormone and then take a week off and have that withdrawal bleed. But in general, we don't recommend coming off for an entire 7 days. You'll notice that the newer pills only have 4 days off, because the 7 days off was when the pill used to be at really strong doses. But now that it's much lower, it was 110, and now it's like 30 is the good dose. And so that's like, 1/4 of the original dose. It's wearing off by day 5, 6, or 7. So I would recommend at the most coming off for 4 or 5 days. I wouldn't do the 6 or 7 because it might run out, especially if you're on the heavier side. You need more medicine anyway, and it takes a while for the hormones to get to the right level. But I'm a strong proponent of #periods optional. And with the pill, you can just keep taking active pills and just never have a bleed. And you can choose if you want to bleed every month, every 3 months, every 6 months, or never.
That's actually great to hear for me as well, because I'm on the birth control pill, and I know a lot of different people, you choose to be on the birth control pills for a lot of the reasons that you named, especially being able to skip our periods. I think that's the main thing we're all very excited about with the pill.
Yes.
So as far as the pill, though, getting into that, does birth control actually expire? Do the pills that we take expire? And if so, can we still take them? Because I know for me personally, this is just a personal statement for myself. I've had birth control pills in the past where I forgot that I had that extra pack, and so I didn't find it for months later. And of course, I took it, but I didn't know, were you supposed to take it if it expires?
Yeah. So if your birth control pill has expired, we don't recommend taking it to prevent pregnancy. However, if you're using it to skip your periods or polycystic ovarian syndrome or whatever, when a drug expires, it usually doesn't just all or nothing. It just goes down lower in its efficacy. So if you're using it for birth control, then I would go get a fresh pack if you're trying to prevent unplanned pregnancy. But if you're using it to skip your period or for acne or for polycystic ovarian syndrome or endometriosis, know that you could use it. It just won't work as well. So that is the same thing with birth control. You could use it, but it just won't work as well. If you got nothing, better something. But if you can go get a fresh pack, go get a fresh pack.
Right, absolutely. And we have a question from YouTube actually for you, Dr. Yen. Does birth control preserve my eggs if I am on the pill? And if so, how does it preserve your eggs?
So unfortunately, by skipping your bleeds every month, you do prevent the eggs from popping out every month, but you don't save the eggs. And it's because we simplify things when we're trying to explain things to patients and even to myself. I forgot as a physician that we tell people that every month, an egg gets ready and then it pops out. But actually every month, like 5 or 10 eggs all get ready. And the one that gets the most hormone wins and then tells the others goodbye. And then they kind of dissolve and your body eats them. And so what happens in the case of taking the birth control pill, I believe the hormone's like, I won, and pretends like it's the egg that won. And so then the other 10 that were going to come out are like, oh, and then they die and get eaten by the body. So it does not add any eggs at the end. I know so many women are like, if that's the case, then I will totally go on birth control pills because I want to save extra at the end.
Yeah, absolutely. Yeah. So we know that birth control doesn't preserve your eggs. Can you take 2 types of birth control?
So Ariana, I think you broke up, but I think you were asking, go ahead.
Cases of contraceptives?
I wouldn't recommend
I'm sorry.
using.
Can you hear me now?
Yes. So I think your question was, can you take 2 types of hormonal contraceptives at once, maybe?
Yes.
Okay. So I would not recommend the pill, the patch, the ring, any of those together at the same time. What I have seen is the IUD or the implant, and then they have like weird, wacky bleeding. And so physicians will be like, well, let's try the birth control pill and see if that will help, calm down the irregular bleeding rather than take out the implant, which is supposed to last for 3 years, or the IUD, which is supposed to last for 5 to 7 years. We've also recently had people say that, the amount of hormone in an IUD is so low and it's right in your uterus area that it doesn't go throughout your body, which is great because it has fewer side effects. However, if you have polycystic ovarian syndrome, which has hormones and it's giving you like zits and hairiness and also just like hormonally unhappy with your body, then the IUD with hormone is not going to help you with that. So I've seen actually somebody recommend a birth control pill plus an IUD if you have polycystic ovarian syndrome. So, but I would never really double up on the hormonal system because that may be too much hormone for your body, not good for you. If you want to double up, always condoms plus something else. And know that we actually have a thing going on with one condoms. I think if you do bit.ly/Pandia, capital P1, capital O, then it's like 40% off a whole bunch of condoms plus lube and a fun pack, meaning you get to try like 10 different types of condoms, like, bumps, flavored, glow in the dark.
Amazing. Wow. I didn't even know we had all that. Can we, and especially for the different methods, can we speak on the new contraceptive method that everyone wants to know about in the articles, of course, the one where women are able to vaginally put cream down there, I believe, or a gel?
Yeah. So that is the latest, but just because it's the latest doesn't mean it's the greatest. So this one is called Phexi, and it makes the sperm move less. So to me, it's just another spermicide. And the risk of pregnancy on it is 17%. Whereas if you use the birth control pill, patch, or ring in a good way, it's 3%. So it's 5
Wow.
times greater the risk of pregnancy, and 17 is close to 20. So 1 in 5 people that use that method are going to get pregnant. I absolutely would recommend Phexi with condoms. I'm always about condoms plus spermicide if you're only using condoms. But if you have the choice of the pill, patch, ring, IUD, implant, shot, anything but just spermicide, I would go with that. And then, condoms always for STI prevention and also not leaking sperm. So it's there.
Absolutely.
But the other negative of Phexi is that it's like $200 a month. And
wow, really?
200 for 12 doses, as opposed to a pack of birth control pills, $15. If you do 3 months of that, you could pay for an IUD. So like, why? I did that. And it's just part of the American system. We charge what we can, and it costs a ton of money to bring a drug to market. So once it goes to market, we have to charge crazy money. And it gets cheap once its patent has run out. And I don't know how long the patent thing is. I'm not a lawyer, but it's like 5, 10, or 20 years later, then they can make the generic, and then it will be affordable. But even then, I wouldn't use it. Again, if it were me, my daughter, or my patient, I'd be like, the pill, the patch, the ring, the IUD, the implant, any of these are better than just straight up spermicide.
Yeah, because I've read an article about it, and so I definitely wanted to get that question, and I know tonight's episode was for that. So I definitely wanted to get that question in. I know a lot of different people, were interested because it's the new thing. It's new, it's fresh. People want to try it just in case. So yeah, that was the main question for that one in particular, because I personally was interested as well. But now that you said that, I didn't even know the cost of it.
Yes.
So I'm glad
people
that
have to think about, what's cost effective, right?
Right. Especially people my age, teenagers, people that are going to school age women who are in college, have a lot of bills. We're looking for the best thing, but also what we can afford.
Yes. And that one's crazy. And you have to reapply it every time you have sex. And I remember, back in my 20s, we'd have like 3 times a night. So then you use it up faster, and it costs per time you use it. It's not $200 a pop. It's $200 for 12 doses. But like, you have 4 nights of fun, and you just wasted $200.
Pretty much. And what happens to your period when you take things like that, especially the cream or the gel and the pills in general? What happens to your period, or your body for that matter?
Yes. So one contraindication for Phexi is if you have a history of urinary tract infections. And it kind of makes sense to me because it's like cream or goop, And so it's important to know your anatomy. If we were to look at your vulva, here's your vagina where babies and blood come out. But right above there is your urethra where your pee comes out. And so if you're very like horny and wet, it gets all, wet and smirky, and it can block up your pee hole. So then the pee can't get out. So same thing with Phexi. It's like extra lube, which is nice, but it could be gloopy or kloopy and block up your pee hole and increase your risk of urinary tract infection. So if you have a history of recurrent urinary tract infection or anything wrong with your kidneys, the Phexi people do not want you to use that because it could block up the pee hole. And in general, I recommend after sex, pee, because then you make sure the pee hole is rinsed out, no matter whether you're using Phexi or not, just to decrease your risk of urinary tract infections. With respect to the pill, the patch, the ring, and your period, the new thing we're educating women about, and that's what we're here at Pandia Health to do, make women's lives better, but to educate you on the latest and greatest. So the latest is we don't call it a period when you're on the pill, the patch, the ring. We call it a withdrawal bleed. And the reason why is with the pill, the patch, the ring, you're on hormones. And then if you stop the hormones by day 2 or 3, it's that drop in hormone, the lack in hormone, that withdrawal from hormone that causes a bleed. And so anytime you miss your birth control pill, patch, or ring 3 days in a row, hormones drop, withdrawal, bleed. And so in a menstruation or a period, your uterus is building up rich, full of blood to a level of, like I call 10, so it can catch the baby or the embryo that you're trying to catch. And then it's like, oh, no baby, no embryo, bleed. And then you bleed a level of 10. However, if you're on the birth control pill, patch, or ring, it just goes to a level of 1 or 2. And so that withdrawal bleed, when you choose to have it, is far less blood.
Gotcha. Amazing. And I'm so glad that, you're taking the time out to say all of these things. This is something that we as women need to know. So whenever, I know you said that a lot of these pills, the different hormones can cause bleeding as well. Is the less androgenic hormone, norgestimate and desperanone, are those the ones that you're referring to?
Yeah, so it's important. I think what we love to teach people is that there are 40 different birth control pills out there. So if you tried one and you didn't like it, there's 39 other different flavors and dosages that you can try. More importantly, there's 8 different progesterones, and there are the relatively newer ones with less androgenic, manly side effects. I call them, like munchies, hairiness, and acne. But you have to counteract them. Like I had one woman and she's like, well, my libido's low, but I don't want acne. And it's like, well, that's the same kind of effect. You have to balance how much libido with how much acne. Because if you want libido, you're going to get acne. So,
absolutely,
it's a balance. And I'm like, you can't have it all. I'm sorry. We haven't figured that out yet. Hopefully in the future, as more doctors and scientists.
We're trying our best.
Yeah, we're doing our best.
Yeah.
So what's interesting, the person on YouTube, brilliant question, is that norgestimate used to be the go-to of all of us in academia. So, Harvard, Stanford, UCSF, Duke, all the major kind of medical institutions. But I forget that medicine is based in the old days on the 70-kilo white man. And so for those of us that are of color, what works for the white person doesn't work for us. And so all these years I've been using the pill. I kept trying to use norgestimate because that was the one that had the least amount of side effects. And I looked back and I had to go through like 3 different pills until I found one that worked for me. And even then I kept trying the norgestimate because I was like, theoretically norgestimate is the best one. So why would I be on anything but? And then I realized that all of medicine, even though the birth control pill was originally tested, I believe, in like Puerto Rico or Costa Rica or something like that. But since all the research has been like the nurses study, which is a whole bunch of Caucasian females in the middle of like, I want to say Georgia or Kansas or something. And so what applies to them doesn't apply to the rest of us. And as we people of color become the majority, this isn't going to work for us. So at Pandia Health, we use norgestimate for a Caucasian female that wants to bleed every month. However, we found looking and studying at the progesterones, looking at the androgenic and progestational side effect, that desogestrel is pretty amazing. And that's the one that we use if you're Latina, Asian, Black, or somebody who wants to skip their bleeds, which is everybody else. And then the least androgenic of them all is drospirenone, which is the progesterone that's in Yaz or Yasmin generic. And the main thing there is I deal with a lot of teenagers and adolescents because that's my specialty, teenagers and young adults. And if you're going to school and you can't drink 8 glasses of water a day, the drospirenone has a diuretic effect. So it makes you pee a little. And so then you get dry and then you get headaches. So we always ask our patients before we started drospirenone, can you drink 8 glasses of water a day? Because if you don't, you might end up with headaches and probably not good for you to go there. But you got to balance headaches versus the least androgenic thing out there. But desogestrel should be fine enough. And she hit the nail on the head that levonorgestrel and norgestrel are the old ones. And so they have a lot of the androgenic kind of side effects potentially, but each person is different. So we give our patients, when they're cash patients, do you want, there's a cheaper one that comes with 84 active pills in a row for $45, or you could take 3 packs of pills, which has 63 active pills. They're both the same price, but this one's cheaper, but this one's levonorgestrel, which might have more side effects, but most people do fine. And if you're on levonorgestrel and norgestrel, you're doing great, no point changing it. But if you're new, why not start on the one that has the least amount of side effects or fewer side effects?
Right. And then once you find something that works for you, you can just stick with it.
Yes.
I think that's what I mainly did as well. I found a birth control that I liked that worked for me, and I stuck with it. I didn't even attempt to try anything else because I know once you find that one for you, you're in. You're in good.
Yes, exactly. Don't try the other one unless you have some side effects you don't like.
Right. And do you recommend is there a generic type of birth control that everyone can take where you think they should start off with? What are your opinions on which one you think they should start with first?
Yeah. So if you're under 30, you should be on a 30 microgram estrogen pill. I gave a talk to a bunch of sororities and like all the women whipped out their pills and like 50% of them were not on 30 micrograms. And so I was like, you need to go back and talk to your doctor because as an adolescent medicine specialist, we are really concerned about bone density, bone health. And it's been shown that if you're on a 30 microgram, your bone density is fine. If you're on a 20 microgram, there have been lesser bone density issues. And so from age 15 to 35, you're putting on your bone density. And so if you're on a lower dose, 20 microgram or 10 microgram estrogen, you're not going to build that bone density. And when you hit 30 and you start losing your bone density, that's going to be a problem. So at least 30 micrograms of estrogen. And then the second one, as I alluded to, if you're a Caucasian female that wants to bleed every month, Norgestimate. And if you're anybody else, I would go with Desogestrel.
Gotcha. And those are probably the most least invasive as well, correct?
Well, they're definitely not invasive, and they've done well for a lot of our customers.
Mm-hmm. So you can say those are the most popular that a lot of people tend to go towards.
I would say that, yeah, we put people on it and like 95% of people do great. And then the 5% that have problems, we can then, maybe look at drospirenone or norethindrone or the other older ones. Again, each person's different. Like normally, I see people will lose a little water weight on the drospirenone because it's a diuretic. It's causing your body to lose water. But I had somebody say they gained weight. And I was like, that's just not logical. It's not possible. But, if it happened to you, then it is you. Each person has a different body and maybe your body is the exact opposite,
Yeah, and getting into that as well. For the final thoughts, we just released an article on benefits of birth control. So do you believe that the benefits are especially because of the hormones that are in the birth control, or is it mentally or internally within women themselves?
Well, I'd say there's definitely a lot of mental benefits in that I think sex is more enjoyable if I know that there's a 3% chance of getting pregnant versus 85% chance of getting pregnant versus 17% chance of getting pregnant, right? And some people like, well, birth control decreases my libido, but I think libido has a psych component and I'm totally into sex if there's no chance of me getting pregnant and no sexually transmitted infections. But if there's a chance of the condom popping and we're not using another method and I might get pregnant, then I'm not all into it, But the medical benefits are definitely from the hormones, specifically if you have polycystic ovarian syndrome, where you have acne and you have hairiness, and you might even have like male pattern balding. Ironically enough, you lose hair, but yet you're hairy, and other issues because in polycystic ovarian syndrome, which affects 1 in 10 women eventually in our lifetimes, and as you gain more weight as well, it takes your female hormone and turns it to male hormone. And the way that the birth control pills help is, one, they shut off your thing, so it's not making female hormones that get turned into male hormones. And then 2, it increases this one thing called the sex hormone binding globulin, and that binds testosterone. So if there's more of the sex hormone binding globulin, there's less testosterone. And with less testosterone, you have less hairiness, less acne, less kind of munchy situation. And the same kind of thing with acne. So if you are a person who's hormonal because you're a teenager, and your hormones are up and down. If we stabilize your hormones, it helps with the acne situation. And it's actually been shown that there are many kind of health problems that are exacerbated by your periods, because every month our hormones are going up and then down and then up and then down, trying to grow that, lining. Embryo, and down and up and down and up and down. And so for diabetes, where the whole goal is to keep your sugar regular, for seizure disorder, which is to keep your hormone level like this so you don't have a seizure, these are two medical conditions that absolutely would benefit from just having a stable hormone rather than 3 weeks and then drop, or our normal with no hormone, up and down and up and down and up and down. But it's also been shown to be good for asthma as well as depression. And then I only would get a zit every month when I got my period. And it was because of the up and down. I don't remember if it was the up or the down or whatever, but every single month I would get a zit. And then I called it the North Star, here, here, here. And once I was on the birth control pill, no more zits.
Oh, wow.
And migraines.
That's really great.
Migraines and headaches. So a lot of women are triggered by their period. And again, up and down, up and down, up and down versus stable.
Absolutely. Yeah, I know migraines were a big one that we talked about in the article. So if anyone's interested as well, we do have an article that we have, so definitely check that out. 100%. Definitely check that out.
Google Pandia Health non-birth control benefits of birth control.
Definitely. Absolutely. Oh, I think my light went out.
It did.
There we go. Okay. So it did. It definitely did go out. I have a new one, actually, a new ring light. So
I need to get a ring light.
Yeah. Absolutely. Yeah, they're wonderful. I promise you, especially for interviews. Yeah. Interviews and of course our lives. So that's great. And then last question, would you recommend skipping periods?
Yes, I absolutely recommend skipping the withdrawal bleed on whatever birth control pill you're on. As I didn't mention, there's the triphasic pills, and those of us in academia don't do the triphasic. The whole point of the triphasic was to mimic the natural cycle. But as I've just told you, it's far more beneficial to just be smooth. And the mimicking of the natural cycle, the hormones are so strong, it's like way up here. So it's just a farce trying to do the tri. So if you look at your birth control and has the word tri in it, or if you look at your pills and there's 4 different colors, then you should ask your doctor for a monophasic, just one, hormonal level. But back to the question of our person on YouTube, love all these questions, is Sprintec, which is a norgestimate-based birth control pill. Other people may know it as Mononessa or Esteria or Monolinia. I've started to learn all of the generics. These are all generics. The original was orthocyclid, just so everybody knows, because everybody thinks they're on a brand, but 95% of birth control is generic. So Sprintec is a generic, and all the other ones are. But that's the norgestimate one. And if I were Asian, I'd try it. And if you can do it, go for it. But I'd say that if it doesn't happen, then go to desogestrel. Look for a birth control pill with desogestrel, which a pre is the one that's 30 micrograms that I remember. And as an academic, I usually teach in generic, but I've learned you can just write the name brand or the brand you happen to remember and write generics okay. And then just let the pharmacy, put in whatever they want. So
yeah, definitely.
That's the same dose.
These are some great questions. Thank you so much, Dr. Yan, for your time. And thank you to those who tuned in. Don't forget to follow us on social media at Pandia Health. And check out the website if you have any questions on the topics that we discussed tonight. As always, feel free to leave us a comment. We're always happy to chat. And have a great night. Thank you, Dr. Yan. Is there anything else that you would like to tell our audience about the birth control method or the basics of it?
I would say check our YouTube. We have a great video on first time on birth control. Here are Dr. Yen's tips. And number 1, don't take it first thing in the morning on an empty stomach.
Absolutely not.
Or you'll get nauseous.
Definitely. Thank you, Dr. Yan.
Thank you.
Bye.
Bye.